A very good evening all. I'm Aditi Lamba with the Thursday night edition of South Asian News. Welcome to Vision of Asia, the voice of our community. We are coming to you from our studio located in New York City. Here is what is happening tonight in the coronavirus pandemic. 3.1 million cases of COVID-19 in the nation with at least 134,000 deaths. A bleak milestone for the United States. At least 33 states are seeing a spike in their coronavirus cases and 70% of the U.S. population has reopening on hold or rolled back. California, Arizona, Texas, and Florida are being hit badly by COVID-19 right now, with Florida reporting more than 8,900 new cases. The state also reported 120 COVID-related deaths, setting a new single-day record for the state with 48 hospitals at ICU capacity. In California, hospitalizations are up 50%. In Arizona, more than 90% of its ICU beds have been filled. And in Texas, the governor has issued a proclamation suspending elective surgeries in more counties to ensure ample supply of hospital beds for COVID-19 patients. As cases and hospitalizations rise, it's becoming even more unclear if students will be returning back to school in the fall. A lot is definitely happening across the nation. We'd like to take this moment to remind all on the importance of social distancing, washing hands, and wearing a mask. Please do your bit in containing the virus, especially if you are in hotspot states. If you are a South Asian medical professional on the front line in these hotspot states, please reach us with your story, your voice, your experience on events at itvgold.com, or if you are an essential business running currently. Globally, there are more than 12 million COVID-19 cases with at least 551,000 deaths, and the World Health Organization has released a new scientific report detailing how coronavirus can pass from one person to the next, including through air. Much tonight on coronavirus pandemic measures, updates, and its impact both in South Asia and here, along with tips on managing stress during the crisis. Here are the headlines. Dr. Rachana Kulkarni on rising COVID-19 cases, hotspots, and cardiac interactions, New Jersey. Simi Arora on mental health, wellness, and management during COVID-19, New York. Global Association of Physicians of Indian Origin hosts COVID-19 information session at AAPI Summit. Time for a short break. Stay with Vision of Asia, Voice of the Community. Will be back shortly. Welcome back. I'm Aditi Lamba, and this is Vision of Asia Thursday night episode. We have tonight much featuring elected officials and medical professionals on the coronavirus impact and measures. Tonight we have highlights from the Global Association of Physicians of Indian Origin (GAPIO's) presentation on COVID-19 updates and information at the AAPI Virtual Summit hosted by American Association of Physicians of Indian Origin. The virtual summit saw top doctors reflect upon developments of COVID-19 and its impact on India, as its caseload now is the world's third largest after United States and Brazil. The total number of daily new infections has been steadily rising in India. The country is seeing more than 767,000 cases with at least 21,000 deaths. World's second most populous nation, the spread of this virus is majorly seen in huge densely populated urban centers in India, where tens of millions of underserved communities reside, with authorities reporting now more than 100,000 cases in the last 5 days. Much on this and other impacts due to the disease, here are the highlights from the doctors who spoke at the COVID-19 information presentation by GAPIO at the AAPI Summit.
This is an excellent 1 hour learning experience, and I got several comments, and everyone is so happy and see the what a comprehensive presentation we have done. And I must congratulate all our panelists, Dr. Ganguly, Dr. Saran, Dr. Gurera, and Dr. Paul. So thank you, everyone. And I think we did a great job. Thank you.
Yes, we do believe that there is, we don't know what the future will hold. What we also know today is that the disease is localized in parts of India. It is not a general pandemic all over in the same way. As you would expect in an infectious disease of this nature, this disease loves people, more the density, more predilection we have for the pandemic to intensify and to affect people. So as of today, 85% of our active cases are in only 8 states. And we have 30 states and 5 union territories. So it is localized. 86% of the problem is in only 8 states. And equally importantly, 51 cities or districts account for 80% of the cases, and thereby more or less also the deaths. These 8 states do include, of course, Maharashtra, Delhi, Gujarat, West Bengal, UP, and of course, Tamil Nadu. So the geographies are limited even today, well into the pandemic globally. It is cities that are more involved, dense areas are more involved. And if you see the map ever, you'll see that it is localized on the western half of India largely. And this is the place where the travelers came in from outside the nation, and the initial spread that occurred through, external, foreign travel people coming into the country started. And these are in any case the large urban megapolis hubs where the flights landed and so on. So we believe that for this part of India, for these states, we are experiencing perhaps the most intense phase. We have huge battle in Maharashtra, but more specifically also in Mumbai, where the situation is now stabilizing. We have Chennai somewhat in a tough situation. It was doing well. Then we had some setbacks, and part of Chennai, or much of Chennai, is under lockdown for second time, or this time around again, for the same reason. Delhi, of course, is experiencing a relatively high escalating surge for the last few weeks. It again, despite our increased testing, has now stabilized around 3,000 cases a day, just above over 3,000 cases a day. The situation is being watched very carefully. In the last 2 weeks, very significant additional measures have been taken by the union government, by the direct intervention of the Prime Minister and the Home Minister.
India has, without research, it can't be done. In 2 areas, India has done well, in the cases of AIDS and in case of polio, where research has guided the containment and the control. I will just take one example how research has guided. For the polio, the AAPI surveillance, the viral molecular surveillance, which we did almost for the world and tracked it around the globe, got the shrinking of the genotypes and created every intervention in India and globally based on that. Then we came to the environmental surveillance, which was very powerful for COVID also. Now we have seen that environmental surveillance will be very, very important. We also went to the bivalent intervention, which was also very, very useful, and which showed the globe that what we can do. And then we introduced IPV in our country, as well as we were now thinking of, because it is again coming up, the vaccine-derived viruses, the new polio vaccine. The same principle will actually prevail for the COVID also. So what we need to do is set up a world-class surveillance, which will provide constant data and feedback to the controllers or the researchers and scientists to come up with the better intervention. They and this has to be done, as we have seen for the AIDS. We have to free the surveillance for the CDC India, ICMR, and other organizations, as well as for the other scientific organizations like ILBS or any other organization which wants to go into surveillance, because that in the AIDS that was very, very rich and useful. So then we come to some science which actually describes this virus. This virus, in about 7 or 8,000 of this virus has been completely sequenced. And this virus is little bit unique because this virus, in India only 2 clades are there, but there are 10 clades which are circulating around the world. There is a thinking, but not a firm thinking, that this particular virus may have such signatures which cause severe asymptomatic or symptomatic disease. But that one very important feature of this virus is this, that it anchors not only ACE2 receptor, but with clathrin and with integrin, and which enters, it not only prevents phagosome-lysosome fusion, it is a very basic charged virus, which is not, other viruses are not that. So it creates a huge metabolic disturbance and an inflammatory disturbance in this. From the bats, what we have learned, that these bats have higher temperature, and so this virus, when temperature normally controls the virus. So when in humans temperature rises, the COVID virus survives over there.
Looking at the coronavirus pandemic, we have been discussing on ITV Gold the psychological effects of the virus and its impact on communities across. Social isolation, job losses, civil unrest, and an uncertain future has seen people reporting high anxiety and depression, presenting a growing psychological toll of COVID-19 on mental health and its wellness. A Census Bureau survey found that 1 in 3 Americans are now reporting these symptoms. So how could we address this wave of mental stress and grief due to loss of life? We spoke with wellness coach and public speaker Simi Arora on building physical, emotional, and spiritual strength during this pandemic. Simi reflected on key ideas to consider during this tough time period and provided some tips to manage our mental health and wellness better. Here is Simi Arora. Welcome to ITV Go, Simi Arora. It's great to have you here with us.
Thank you very much for having me today on the show.
You know, let's talk about anxiety, because right now in the COVID-19 time period, anxiety, fear, panic is something that we've seen across the nation. And it's something that's impacting people, communities of all color. What do you say to people that are experiencing anxiety and they're trying to deal with what's happening around them right now with COVID-19? What perhaps should they do to work on it?
Well, first of all, we need to understand what is the root cause of anxiety, because anxiety itself is not a disease, it's a symptom. It is telling you that you need to pay attention more towards your emotional health. It is telling you that there are some things that probably you need to take an action towards, and you are trapping yourself into those unnecessary emotional conflicts or the past experiences which have had this tremendous impact on your system. But now, because your body is experiencing anxiety in form of its manifestation, probably, sort of like headaches or digestive issues or heart palpitations, which is normally happening with all the people who go through anxiety. So not distracting yourself from the anxiety and just popping a pill or just going to a psychiatrist and taking medication, which is extremely important. We're going to get into that in a little bit of detail. But most important thing is to understand what is causing me this. Why am I experiencing the anxiety? And then we go back to our thoughts. We go back to our beliefs, because some of these thoughts are really the hindrances, because the way we think and the way our mind works is what we actually experience in our body and in our life.
What would you say to someone who has lost a loved one? Because that is the story of millions of people right now. Pretty much everybody knows somebody that has been affected by COVID.
Well, it is unimaginable to experience someone's pain who have lost a loved one, and it is very unfortunate and very sad experience of life. And what I can say to them is that, you know, acceptance of someone's life or a life being born or dead is something that is not in our control. And what we can do is to allow our hearts to heal and have the, you know, the enlargement, or I would say the compassion towards other beings who are still there on the planet, and something that we can do to make a difference in their lives. Because it's very simple phenomena that I've seen, that people who go through cancer or people who go through mental health issues, they suddenly have a lot of compassion for other people who are going through the same problems. And this is how life teaches us to be more compassionate. So when someone loses a loved one, they can really understand the value of life and how they can come forward and help in healing other people as well. So first, their own healing has to happen, which comes with acceptance, with time, and with letting go and embracing the goodness of that life which was around them. And secondly, extending that love and warmth and compassion to others.
One last message to our audience.
One last message to the audience is that live like a caveman for 30 minutes to 1 hour every day. I know this is going to work as magic. We have burdened ourselves unnecessarily. We have been used to of living in the world of transactions. But you, my friend, are born genius. You are born to express your truth. You're born to be here and express whatever you got in your being and share that beautiful consciousness with everybody else. So even if you're feeling disheartened, know that it's just a small phase and it's just gonna go away. Just chill, relax, and enjoy life as is, and do your best and take heart-aligned actions.
Yes, of course. Well, thank you again for your time here on ITV Gold. I appreciate it.
Thank you so much, Aditi, for having me on the show. It was such a great time. I appreciate you being here and asking wonderful questions.
Of course. It's time for the short break. Stay with us in Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Continuing our report on the coronavirus pandemic impact and measures, today U.S. top health official Dr. Anthony Fauci said that the states seeing a large increase in COVID-19 cases should seriously look at shutting down or pausing most of their reopening, while explaining that the states with high cases need to start implementing measures to keep people socially distanced and also avoid congregations, while also reminding all that the U.S. still has not gotten out of the first wave of this disease, saying that we are knee-deep in the first wave, and for people to not confuse the rise of cases in the South and West as the second wave of COVID-19, which is expected to happen this coming fall. Currently, states Florida, Texas, Arizona, and California are now the new hotspots, with COVID-19 case rate increasing rapidly. On this, along with vaccination for COVID-19 and the fate of schools, earlier today we spoke with top cardiologist Dr. Rachana Kulkarni. Discussing the rise in case numbers, Dr. Kulkarni urged all to continue practicing social distancing, wear a mask, and wash your hands. Here is Dr. Rachana Kulkarni. The biggest question that's being asked around the entire nation: did we as a nation open too fast? There are states that are surging in numbers that are unbelievable, and we are getting a little bit worried about what's happening in the South and West. So how are you looking at this entire situation right now?
So Aditi, it's the numbers speak for themselves, right? You have seen where we were when we had our last conversation, where we were in New York and New Jersey, and the numbers were soaring. And then we did the right thing. And the right thing being wearing masks, social distancing, and staying home whenever we can, and not opening too fast. All those precautions and all those measures have paid their dividends, and New York, New Jersey rates for COVID are much, much less. Now, think about how things are where these precautions were not followed,
Right.
because the message in the country is not consistent. Uh, so where we opened up too fast, where uh, wearing a mask when you step outside is not mandatory, where bars and other businesses and restaurants, etc., were open, you have seen a very alarming rate of surge in all those states. So I think the numbers speak for themselves.
Yeah. I want to talk to you about masks because this is something that's been discussed heavily in the last 2 weeks. Just yesterday, New Jersey, the state you're coming from right now, the governor mandated a mask rule in public places where social distancing cannot be maintained. How important do you think it's going to be for us to have a universal masking mandate, perhaps where the entire nation is required to wear a mask if they are in public where social distancing cannot be maintained?
I think it's extremely important. And I think it's such a simple measure that can go such a long way. I don't see any reason not to do it at this point.
Yes, for sure. You know, looking at more of the COVID-19 cases, I'd like to now reflect on the drug trials as well as vaccination. Currently, the US government has awarded $1.6 billion to one of the leading pharmaceutical companies that is working on bringing 100 million doses of this vaccine by January. What is your prediction with this one company, and do you think it's feasible or effective to get a vaccine by that time period?
I would be cautiously optimistic about it, but we all know in medical field and even otherwise also, the problems come when the rubber meets the road. So, and we at this point we don't know enough about the virus. I don't think that we know what kind of immunity will the vaccine provide. In addition, let's not forget that these viruses tend to mutate. So I'm hopeful, but I'm cautiously optimistic.
And what are your comments here on remdesivir? Because that's one drug that we are hearing about a lot nationally and internationally. How are you looking at that one medication?
That's the only medication at this point that has been shown in clinical trials to be effective. But let's see what it does. What it does, Aditi, at this point is that it just cuts down the days of hospitalization. So that is what the clinical trials have shown. It does not prevent COVID. It just cuts down the acuity of the disease.
What do you think is the best way to protect ourselves?
Masks, hand washing, social distancing. Be smart.
What, according to you, since we were the epicenter ones, the state of New York and the state of New Jersey where you're coming from, what lessons should these other states that are spiking in cases should learn from, you know, the once an epicenter? What do you think they need to do right away? And is shutting down a possibility?
I think we need strong, consistent messaging from the leadership in the state, and we have to look at what is right for the communities in that state, what is right for the population in the state, and that means we have to learn from New York and New Jersey, who got impacted heavily but did the right thing by shutting down, by social distancing, by taking all the appropriate precautions. I think that's very important for the other states to do.
I would love for you to give one last message to our audience.
At this point for COVID-19, we don't have a preventive treatment. We don't have a vaccine. So in absence of that, what we can do is all in our hands. What we have in our hands is hand hygiene, wearing masks, and social distancing. We can partially control our destiny. So till science comes to rescue us, let's do what we can.
And that is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on event at itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.